My name is Sunmoon Lee. I'm a general pediatrician and I work for Community Memorial Health System. A pediatrician is different from a family medicine physician in the fact that we focus on just children. I think of it like in sports. So sometimes like a family physician would be like a small forward in basketball who does rebounds, they play near the basket, whereas a point guard specializes more around the perimeter and passing the ball. And so I think as pediatricians, as point guards who focus more on one specialty, and that's, for us, that's children. Pediatricians generally treat patients from the time they're born to roughly around 18. Now, sometimes there are special circumstances such as cardiac diseases or cystic fibrosis, or even sometimes diabetes, where we will see patients until they're 21. And then there are also sometimes other special circumstances with patients with special needs where we'll see them beyond that until we can find an adult provider who is appropriate and the parents feel comfortable seeing them. So, how often you should see your pediatrician kind of depends on the situation. So oftentimes there are things that we call well child checks. So those are like maintenance visits, like when you take your car in for a tune-up or just make sure everything's working and functioning well. So when you're younger, you go every 2 months to 3 months, and as you get older, you go once a year. But there are certain things, such as like ADHD, where you come in every 3 to 4 months because we need to do a blood pressure check or a weight check. Sometimes with kids who have different problems, we have them come in various months. It could be 6 months, it could be 3 months. So it depends on your child. And that's the most important part of pediatric care, is to customize the care that your child receives based on what condition, or even if they're just generally healthy. Sometimes it's a great thing to meet your pediatrician before your child is born. I feel like a pediatrician or a doctor is like shoes. Sometimes you go to the store, you look at the shoe and you're like, that thing looks awesome, and you put it on and it feels like rocks. And so sometimes just meeting the pediatrician before your child is born is a good way just to get their vibe and their philosophy. Sometimes there's questions about vaccinations and things like that. And so it's a great way just to kind of meet somebody who's going to be, your guide through parenthood. Whenever you come to the doctor for a well child visit, there's different things based on your child's age. So if you have a newborn, we're looking at talking about weight and how the feeds are going, talking about how they're sleeping. But that actually extrapolates to the rest of the child's life. But every time that you come in, I think of it as my goal, just in case there's something that we may not be doing correctly. Sometimes we're giving too much milk. Sometimes we're not getting enough sleep. So I think of my job as helping parents realize, hey, there could be something we could be doing a little differently. And I also feel like there's some parents where they have a large gap between children. And so everybody just assumes, oh, they're an experienced parent, they know what they're doing. I have 2 kids and they're 3 years apart, and there are some times where I'm like, did my first one do that? Did they not do that? And also things that you are curious that are normal. And so sometimes as a parent, you come in with just a list of questions that, hey, my child does this, is this okay? Hey, I was thinking about trying this out with my child, what's your perspective? So sometimes it can just be everything from just fears or to just what we're doing with sleep, eating, and how they're pooping. So for a general pediatrician, I don't think that there is necessarily a limit of what you can diagnose and treat. I think that's the reason why we're general pediatricians, is because we deal with almost every single part of the child's life and health. And so whether it's depression or anxiety, especially during this time after a pandemic or during a pandemic, I think there's a lot of kids with anxiety. Even though I'm not a psychiatrist or not a licensed therapist, I deal with mental health issues. When it comes to illnesses such as COVID or ear infections or pneumonias, UTIs, also with constipation or blood in the stool, I actually feel like it's my job to help a parent with everything when it comes to their child's health. Sometimes for pediatricians, we do diagnose and treat many conditions, but sometimes there are things that are just more specialized. And so we'll refer out to a cardiologist, or we refer out to a pulmonologist, a lung specialist. And in those cases, sometimes we almost act like a general contractor, where we know enough that we know that there's a problem, or that we know that there's something that needs to be treated more specifically, but you need to be referred to a specialist who has specific training in that area. Even though I do understand cystic fibrosis or things like tetralogy of Fallot or hypoplastic left heart, I wouldn't be the right person to manage that condition. part of the thing that I love about working in Ventura is treating patients who went to the same elementary school, same middle school, same high school I went to, and who still have some of the same teachers and counselors that I had. But also, part of this is just very personal for me because I consider Ventura my home and the place I never want to move away from. And the better care that the patients and the kids get in our community, the better our community is.